Under the new PIP statute, there is a restricted number of medical providers that can say that you have this emergent medical condition needed to receive your full $10,000 in PIP medical benefits. If you do not have a diagnosis of an emergent medical condition, or an EMC for short, you are going to be otherwise restricted to only $2,500 for your medical care and treatment. To receive the full amount, remember, you must present for care within 14 days from the date of your accident. Now, let's talk about the types of medical providers that can make this emergent medical condition diagnosis. They are only the following. Number one, a medical doctor. That's an MD, someone with an MD at the end of their name. Number two, a doctor of osteopathy. That's someone with a DO at the end of their name. An advanced registered nurse practitioner. That's the third, or ARNP for short. And last but not least, a dentist. That would be in the case of someone having damage to their teeth or mouth as a result of a collision. Again, only these four folks can ever say that you have this condition serious enough to warrant receiving your full $10,000 in benefits. Now let's talk about all the folks who can say you don't have an emergent medical condition. Pick any other type of medical provider and that's your answer. For instance, a chiropractor. Doctors who have been the front line in treating accident victims for decades. They cannot diagnose an emergent medical condition, but they can sure as heck say that you don't have it. What does that mean? It means the insurance industry is going to be able to go out and get nurses, not advanced registered nurses, just nurses, chiropractors, and any other type of provider. They don't have to see you. All they have to do is glance at your medical records and say no. And then the insurance company will have a basis to say, I'm sorry, Mr. and Mrs. So-and-so, we're not paying $10,000 on this claim. We're paying $2,500 because it's not an EMC. What do you do when this happens? Well, what you have to do is do the right things from the start. Again, present within 14 days. Be seen by a facility that has MPs or DOs or ARNPs. Or see a dentist if you have damage to your mouth. If you don't, and even if you do, the insurance industry is going to use all these other people who can say that it's not an EMC to try to deny your claim. What does this mean? It means you should hire an attorney as soon as you can after your accident. Listen, the last thing folks want to do is to get in an accident and have to deal with a lawyer. I've been there. I've had to make that call in my family. But now, not only are you going to fight the person in the insurance company that caused your accident, but your own insurance company. Because look at how easy it is. They have unlimited amount of specialists who can say you don't have this condition. You only get 4, and you get 14 days to get it right. You better act fast. And if you don't know what you're doing, you should call someone who does. Again, we're here to help. We're here to tell you about these things and to help steer you in the right directions so that you don't lose benefits that you paid good and valuable money for.